genuine followers and ardent fans. How are you and your blood today? It is social activist from Good Hearted Preacher, Professor S. Suresh, back with absolute delight for my 105th video on annual of publication on YouTube today, 5th November 2020, Thursday. I have selected infertility, also known as impotency, a blessing in disguise. For presentation today, this video is strictly for adults. At the outset, infertility is a natural phenomenon and society should refrain from harassing such females. There is no real necessity to worry. There is so much exploitation of such females in the name of infertility treatment clinics, assisted reproduction centers, acts, surrogacy, artificial insemination, as if humans are cattle, etc. Biological children are God's gift. It is weird when you think in that. One hand, ladies who do not wish to have children, since they have enough, either opt for medical termination pregnancy, MTP, or kill the infant since it's a female, taboo, especially in countries like India. Some other ladies offer MTP since it's out of wedlock or underage or forced fighters. On the other hand, we have females who crave for a baby and spend their hard-earned money on looting centers, so-called treatment clinics. Some others opt for surrogacy, surrogate mothers, whom renting. I don't know where the world is going to. People are renting their rooms. I'll justify why I'm saying it's a blessing in disguise, so watch this presentation till the end, okay? Otherwise, it may misconstrue. Fertility is a natural capability to produce offspring. As a measure, fertility rate is the number of offspring born per mating pair, individual or population. Fertility differs from fecundity, which is defined as a potential for reproduction influenced by gamete production, fertilization, and carrying the pregnancy to term. A human being's pregnancy term varies between 270 plus or minus 10 days from the date it starts. Okay, a lack of fertility is infertility, while a lack of fecundity would be called sterility. Humans' fertility depends on factors of nutrition, sexual behavior, consanguinity, culture, instinct, endocrinology, timing, economics, way of life, and emotions. In demographic context, fertility refers to the actual production of offspring rather than the physical capability to produce, which is termed fecundity. While fertility can be measured, production of fecundity cannot be. Demographers measure the fertility rate in a number of ways, which can be broadly broken into period measures, and cohort measures. Period measures refer to a cross-section of the population in 1 year. Cohort data, on the other hand, follows the same people over a period of decades. Both period and cohort measures are widely used. A parent's number of children strongly correlates with the number of children that each person in the next generation will have. Factors generally associated with increased fertility include religiosity, intention to have children, and maternal support. Factors generally associated with the decreased fertility include wealth, education, female labor participation, urban residence, cost of housing, intelligence, increased female age, and to a lesser degree, increased male age. Certain physical conditions make it impossible for a woman to conceive. It's called involuntary infecundity. If a woman has a condition making it possible but unlikely to conceive, this is termed subfecundity. Venereal diseases, especially gonorrhea, syphilis, and chlamydia are common causes. Nutrition is a factor as well. Women with less than 20% body fat may be subfecund, a factor of concern for athletes and people susceptible to anorexia. Demographer Ruth Frisch has argued that it takes 50,000 calories to make a baby. I don't know how we estimated that. There is also subfecundity in the weeks following childbirth, and this can be prolonged for a year or more through breastfeeding. A furious political debate raged in the 1980s over the ethics of the baby food companies marketing infant formula in developing countries. A large industry has developed to deal with subfecundity in women and men. An equally large industry has emerged to provide contraceptive devices designed to prevent contraception. The effectiveness in use varies. On average, 85% of married couples using no contraception will have a pregnancy in 1 year. The rate drops to the 20% range when using withdrawal vaginal sponges or spermicides. This assumes the partners never forget to use the contraceptive. The rate drops to only 2% or 3% when using the pill or an intrauterine device, IUD, and drops to near 0% for implants and 0% for tubal litigation, sterilization of the woman, tubectomy, or a vasectomy for the man. After a fetus is conceived, it may or may not survive to birth. Involuntary fetal mortality involves natural abortion, miscarriages, and stillbirth. The fetus born dead. Human intervention intentionally causing abortion, that is medical termination of pregnancy of the fetus, is called therapeutic abortion. Women have hormonal cycles which determine when they can achieve pregnancy. The cycle is approximately 28 days long with a fertile period of 5 days per cycle, but can deviate normally from this norm. Men are fertile continuously, but the sperm quality is affected by the health, frequency of ejaculation, and environmental factors. Fertility declines with age in both sexes. In women, the decline is more rapid, with complete infertility normally occurring around the age of 50. Pregnancy rates for sexual intercourse are highest when it is done every 1 or 2 days or every 2 or 3 days. Studies have shown no significant difference between different sex positions and pregnancy rate as long as it results in ejaculation into the vagina. A woman's menstrual cycles begins as it has been arbitrarily assigned with menses. Next is the follicular phase where estrogen levels build as the ovum matures due to the follicular stimulating hormone FSH within the ovary. When estrogen levels peak, it spurs a surge of luteinizing hormone LH, which finishes the ovum and enables it to break through the ovary wall. This is ovulation. During the luteal phase, which follows ovulation, LH and FSH cause the post-ovulation ovary to develop into the corpus luteum, which produces progesterone. The production of progesterone inhibits the LH and FSH hormones, which in a cycle without pregnancy causes the corpus luteum to atrophy and menses to begin the cycle again. Peak fertility occurs during just a few days of the cycle, usually 2 days before and 2 days after the ovulation date. This fertile window varies from woman to woman. It's a natural process, definitely there will be variation. Just as the ovulation date often varies from cycle to cycle for the same woman. The ovule is usually capable of being fertilized for up to 48 hours after it is released from the ovary. Sperm survive inside the uterus between 48 and 72 hours on average, while the maximum being 120 hours, 5 days. These periods and intervals are important factors for couples using the Rutherford method or contraception. The average age of menarche in the US is about 12.5 years. In post-menarchal girls, about 80% of the cycles are anovulatory. Ovulation does not actually take place in the first year after menarche, 50% in the third year, and 10th in the sixth year. Menopause occurs during a woman's midlife between ages 48 and 55. During menopause, hormonal production by the ovaries is reduced, eventually causing a permanent cessation of the primary function of the ovaries, particularly the creation of the uterine lining, period. This is considered the end of the fertile phase of the woman's life. Males also have a similar thing. It is called andropause. The following effects of age and female fertility have been found in women trying to get pregnant without using fertility drugs or in vitro fertilization, IVF, data from 1670 to 1830. At age 30, 70% will have a conception ending in a live birth within 1 year. 91% will have a conception ending in a live birth within 4 years. At age 35, 66% will have a conception ending in a live birth within 1 year. 84% will have a conception ending in a live birth within 4 years. At age 40, 44% will have conception ending in a live birth within 1 year. 64% will have conception ending in live birth within 4 years. Use of fertility drugs and or IVF can increase the chances of becoming pregnant at a later age. Successful pregnancies facilitated by fertility treatment have been documented in women as old as 67. Studies since 2004 now show that mammals may continue to produce new eggs throughout their lives rather than being born with a finite number as previously thought. Researchers at the Massachusetts General Hospital in Boston, US say that if eggs are newly created each month in humans as well, all current theories about the aging of the female reproductive system will have to be overhauled, although at this time this is simply conjecture. According to the March of Dimes, about 9% of recognized pregnancies for women aged 20 to 24 ended in miscarriage. The risk arose to about 20% at the age 35 to 39, more than 50% at the age 42. Birth defects, especially those involving chromosome number and arrangement, also increase with the age of the mother. According to the market lines, at age 25, the risk of having a baby with a Down syndrome is 1 in 1,340. At age 30, your risk is 1 in 940. At age 35, your risk is 1 in 353. At age 40, your risk is 1 in 85. At age 45, your risk is 1 in 35. Some research suggests that increased male age is associated with a decline in semen volume, sperm motility, and sperm morphology. In studies that control for female age, comparisons between men under 30 and men over 50 found relative decreases in pregnancy rates between 23% and 38%. It is suggested that sperm count declines with age, with men aged 50 to 80 years producing sperm at an average rate of 75% compared with men aged 25 to 50 years, and that larger differences are seen in how many of the seminiferous tubules in the case testes contain mature sperm. In males 20 to 39 years old, 90% of the seminiferous tubules contain mature sperm. In males 40 to 69 years old, 50% of the seminiferous tubules contain mature sperm. In males 80 years old or older, 10% of the seminiferous tubules contain mature sperm. Decline in male fertility is influenced by many factors, including lifestyle, environment, and psychological factors. Some research also suggests increased risks for health problems for children of older fathers, but no clear association has been proven. Large-scale in-stage studies suggested that the children of men 40 or older were 5.7 times more likely than children of men under 30 to have an autism spectrum disorder, controlling for year of birth, socioeconomic status, and maternal age. Increased paternal age is suggested by some to directly correlate to schizophrenia, but it is not proven. Australian researchers have found evidence to suggest overweight obesity may cause subtle change to sperm and prevent a healthy pregnancy. They say fertilization was 40% less likely to succeed when the father was overweight. American Fertility Society recommends an age limit for sperm donors of 50 years or less, and many fertility clinics in the UK will not accept donations from men over 40 or 45 years of age. Infertility primarily refers to the biological inability of a person to contribute to conception. Infertility may also refer to the state of a woman who is unable to carry a pregnancy to full term. There are many biological causes of infertility, including some that medical intervention can treat. Infertility is the inability of a person, animal, or plant to reproduce by natural means. It is usually not the natural state of a healthy adult, except notably among certain eusocial species, mostly haplodiploid insects. In humans, infertility is the inability to become pregnant after 1 year of intercourse without contraception involving a male and female partner. There are many causes of infertility, including some that medical intervention can treat. Estimates from 1997 suggest that worldwide, about 5% of the heterosexual couples have an unresolved problem with infertility. Many more couples however, experience involuntary childlessness for at least 1 year. Estimates range from 12% to 28%. Excuse me. Male infertility is responsible for 20 to 30% of infertility cases, while 20 to 35% is due to female infertility, and 25 to 40% is due to combined problems in both parts. In 20% of cases, no cause is found. The most common cause of female infertility is ovulatory problems, which generally manifest themselves by spars or absent menstrual periods. Male infertility is more commonly due to deficiencies in the semen, and semen quality is used as a surrogate measure of mate fecundity. Women who are fertile experience a natural period of fertility before and during ovulation, and they are naturally infertile for the rest of the menstrual cycle. Fertility awareness methods are used to discern when these changes occur by tracking changes in cervical mucus or basal body temperature. Demographers tend to define infertility as childlessness in a population of women of reproductive age, whereas the epidemiological definition refers to time to pregnancy, generally in a population of women exposed to the probability of conception. Currently, female fertility normally peaks at age 24 and diminishes after 30, with the pregnancy occurring rarely after age 50. A female is most fertile within 24 hours of ovulation. Male fertility peaks usually at age 25 and declines after age 40. The time needed to pass during which the couple tries to conceive for the couple to be diagnosed with infertility differs between different jurisdictions. Existing definitions of infertility, lack of uniformity, rendering comparisons and prevalence between countries are over time problematic. Therefore, data estimating the prevalence of infertility cited by various sources differ significantly. A couple that tries unsuccessfully to have a child after a certain period of time, often a short period where definitions vary, is sometimes said to be subfertile, meaning less fertile than a typical couple. Both infertility and subfertility are defined as the inability to conceive after a certain period of time, the length of which vary. So often the two terms overlap. The World Health Organization, WHO, defines infertility as follows. Infertility is a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse, and there is no other reason such as breastfeeding or postpartum amenorrhea. Primary infertility is infertility in a couple who have never had a child. Secondary infertility is failure to conceive following a previous pregnancy. Infertility may be caused by infection in the man or woman, but often there is obvious underlying cause. Primary infertility is defined as the absence of a live birth for women who desire to have a child and have been in a union for at least 12 months during which they have not used any contraceptives. The WHO also adds that women whose pregnancy spontaneously miscarries or whose pregnancy results in a stillborn child without ever having had a live birth would present with primary infertility. Secondary infertility is defined as the absence of a live birth for women who desire a child and have been in union for at least 12 months since their last birth, during which they did not use any contraceptives. Thus, the distinction feature is whether or not the couple have ever had a pregnancy which led to a live birth. The consequences of infertility are manifold and can include societal repercussions and personal suffering. Advances in assisted reproductive technologies, ART, such as IVF, in vitro fertilization, can offer hope to many couples where treatment is available, although barriers exist in terms of medical coverage and affordability. The medicalization of infertility has unwittingly led to a disregard for the emotional responses for the couple's experience, which include distress, loss of control, stigmatization, and a disruption in the developmental trajectory of adulthood. Infertility may have psychological effects. Partners may become more anxious to conceive, increasing sexual dysfunction. Marital discord often develops especially when they are under pressure to make medical decisions. Women trying to conceive often have depression rates similar to women who have heart disease or cancer. Emotional stress and marital difficulties are greater in couples where infertility lies with the man. Older couples with adult children appear to live longer. Why this is the case is unclear and may depend in part on those who have children adopting a healthier lifestyle, support from children, or the circumstances that led to not having children. In many cultures, inability to conceive bears a stigma. In close social groups, a degree of rejection or a sense of being rejected by the couple may cause considerable anxiety and disappointment. Some respond by actively avoiding the issue altogether. Middle class men are most likely to respond in this way. In the US, some treatments for infertility, including diagnostic tests, surgery, and therapy for depression, can qualify one for Family and Medical Leave Act. In US, as per the studies, 1 in 5 couples are infertile. It has been suggested that infertility can be classified as a form of disability. Anti-sperm antibodies, ASA, have been considered as infertility cause in around 10 to 30% of infertile couples in both men and women. ASA production are directed against surface antigens and sperm, which can interfere with sperm motility and transport through the female reproductive tract, inhibiting capacitation and acrosome reaction, impact fertilization, influence on the implantation process, and impact growth and development of the embryo. The antibodies are classified into different groups. There are IgA, IgG, and IgM antibodies. They also differ in the location of the spermatozoa they bind on. Head, might, midpiece, tail. Factors contributing to the formation of anti-sperm antibodies in women are disturbance of normal immune regulatory mechanisms, infection, violation of the integrity of the mucous membranes, rape, and unprotected oral and anal sex. Risk factors for the formation of anti-sperm antibodies in men include the breakdown of blood-testis barrier, trauma and surgery, arthritis, varicose infections, prostatitis, testicular cancer, failure of immunosuppression, and unprotected receptive anal or oral sex with men. Infections with the following sexually transmitted pathogens have a negative effect on fertility: chlamydia, trachomatis, and Neisseria gonorrhoeas. There is consistent association of Mycoplasma genitalium infection and female reproductive tract syndrome. Mycoplasma genitalium infection is associated with increased risk of infertility. Mutations of the NR5A1 gene encoding steroidogenic factor SF1 have been found in a small subset of men with the non-obstructive male factor infertility where the cause is unknown. Results of one study investigating a cohort of 315 men revealed changes within the hint range of SF1 and no rare allelic variation in female fertile controlled men. Affected individuals displayed more severe forms of infertility such as azoospermia and severe oligozoospermia. Factors that can cause male as well as female infertility are DNA damage. DNA damage reduces fertility in female oocytes as caused by smoking, other xenobiotic DNA damaging agents such as radiation or chemotherapy, or accumulation of the oxidative DNA damage, hydroxydeoxyribonucleic. DNA damage reduces fertility in male sperm as caused by oxidative DNA damage, smoking, other xenobiotic DNA damaging agents such as drugs or chemotherapy, or other DNA damaging agents, including reactive oxygen species, fever, or high testicular temperature. The damaged DNA to infertility manifests itself by the increased susceptibility to denaturation inducible by heat or acid, or by the presence of double-strand breaks that can be detected by the tunnel assay. General factors: diabetes mellitus, thyroid disorders, undiagnosed and untreated celiac disease, adrenal disease, hypothalamic pituitary factors, hypoprolactinemia, hypopituitarism. The presence of anti-thyroid antibodies is associated with an increased risk of unexplained self-fertility with an odds ratio of 1.5 and 95% confidence interval of 1.1 to 1.1 to 2. The environmental factors: toxins such as glues, volatile organic solvents, silicones, physical agents, chemical dust, and pesticides. Tobacco smokers are 60% more likely to be infertile than non-smokers. German scientists have reported that a virus called adeno-associated virus might have a role in male infertility, though it is otherwise not harmful. Other diseases such as chlamydia and gonorrhea can also cause infertility due to internal scarring, fallopian tube obstruction, alimentary habits, obesity. The obesity epidemic has recently become a serious issue, particularly in industrialized nations. The rising number of obese individuals may be due in part to an energy-rich diet as well as insufficient physical exercise. In addition to other potential health risks, obesity can have a significant impact on male and female fertility. Body mass index (BMI) may be a significant factor in fertility, as an increase in BMI in the male as little as 3 units can be associated with infertility. Several studies have demonstrated that an increase in BMI is correlated with a decrease in sperm concentration, decrease in motility, and increased DNA damage in sperm. A relationship also exists between obesity and erectile dysfunction (ED). ED may be the consequence of the conversion of androgens to estradiol. The enzyme aromatase is responsible for this conversion and is found primarily in adipose tissue. As the amount of adipose tissue increases, there is more aromatase available to convert androgens, and serum estradiol levels increase. Other hormones, including inhibin and leptin, may also be affected by obesity. Inhibin B levels have been reported to decrease with increasing weight, which results in decreased Sertoli cells and sperm production. Leptin is a hormone associated with numerous effects, including appetite control, inflammation, and decreased insulin secretion. According to many studies, obese women have higher rate of recurrent early miscarriage compared to non-obese women. Low weight. Obesity is not the only way in which weight can impact fertility. Men who are underweight tend to have lower sperm concentrations than those who are at a normal BMI. For women, being underweight and having extremely low amounts of body fat are associated with ovarian dysfunction and infertility, and they have a higher risk for preterm birth. Eating disorders such as anorexia nervosa are also associated with extremely low BMI. Although relatively uncommon, eating disorders can negatively affect menstruation, fertility, and maternal and fetal well-being. The following causes of infertility may be found in females. For a woman to conceive, certain things have to happen. Vaginal intercourse must take place around the time when an egg is released from her ovary. The system that produces eggs has to be working at optimum levels, and our hormones must be balanced. For women, problems with fertilization arise mainly from either structural problems in the fallopian tube or uterus, or problems releasing eggs. Infertility may be caused by blockage of the fallopian tube due to malformations, infections such as chlamydia, or scar tissue. For example, endometriosis can cause infertility with the growth of endometrial tissue in the fallopian tubes around the ovaries. Endometriosis is usually more common in women in their mid-20s and older, especially when postponed childbirth has taken place. Another major cause of infertility in women may be the inability to ovulate. Malformation of the eggs themselves may complicate conception. For example, polycystic ovarian syndrome (PCOS), which is the eggs are only partially developed within the ovary and there is an excess of male hormones. Some women are infertile because their ovaries do not mature and release eggs. In this case, synthetic FSH by injection of clomiphene citrate via a pill can be given to stimulate follicles to mature in the ovaries. Other factors that can affect the woman's chances of conceiving include being overweight or underweight or her age, as female fertility declines after the age of 30. Sometimes it can be a combination of factors and sometimes a clear cause is never established. Common causes of infertility of females include ovulation problems, PCOS, the leading reason why women present to fertility clinics due to ovulatory infertility, tubal blockage, pelvic inflammatory disease caused by infections like tuberculosis, age-related factors, uterine problems, previous tubal litigation, endometriosis, advanced maternal age, immune infertility. The main cause of male infertility is low semen quality. In men, however, the necessary reproductive organs to procreate. Infertility can be caused by low sperm count due to endocrine problems, drugs, radiation, or infection. There may be testicular malformations, hormone imbalance, or blockage of the man's duct system. Although many of these can be treated through surgery or hormonal substitution, some may be indefinite. Infertility associated with viable but immotile sperm may be caused by primary ciliary dyskinesia. The sperm must provide the zygote with the DNA, centrioles, and activation factor for the embryo to develop. A defect in any of these sperm structures may result in infertility that will not be detected by semen analysis. Anti-sperm antibodies cause immune infertility. Cystic fibrosis can lead to infertility in men. In some cases, both a man and woman may be infertile or subfertile. The couple's infertility arises from the combination of these conditions. In other cases, the cause is suspected to be immunological or genetic. It may be that each partner is independently fertile, but the couple cannot conceive together without assistance. Treatment depends on the cause of infertility but may include counseling. Fertility treatments which include IVF, in vitro fertilization. Couples with estimated live birth rate at 40% or higher per year are encouraged to continue aiming for a spontaneous pregnancy. Treatment methods for infertility may be grouped as medical or complementary and alternative treatment. Some methods may be used in concert with other methods. Drugs used for both women and men include clomiphene citrate, human menopausal gonadotropin (HMG), follicle stimulating hormone (FSH), human chorionic gonadotropin (HCG), gonadotropin releasing hormone (GnRH) analogs, aromatase inhibitors, and metformin. Medical treatment of infertility generally involves the use of fertility medication, medical device, surgery, or a combination of the following. If the sperm are of good quality and the mechanics of the woman's reproductive structures are good, pattern fallopian tubes, no adhesions or scarring, a course of ovulation induction may be used. The physician may also suggest using a conception cap. Cervical cap, which the patient uses at home by placing the sperm inside the cap and putting the conception device on the cervix, or intrauterine insemination (IUI), in which the doctor introduces sperm into the uterus during ovulation via a catheter. In these methods, fertilization occurs within the body, inside the body. If conservative medical treatments fail to achieve a full-term pregnancy, the physician may suggest the patient undergo IVF. IVF and related techniques ICSI, ZIFT, ZIFT, GIFT are called ART, assisted reproduction technology. ART generally start with stimulating the ovaries to increase egg production. After stimulation, the physician surgically extracts one or more eggs from the ovary and unites them with the sperm in a laboratory setting with the intent of producing one or more embryos. Fertilization takes place outside the body and the fertilized egg is reinserted into the woman's reproductive tract in a procedure called embryo transfer. Other medical techniques are, example, tuboplasty, assisted hatching, and implantation, genetic diagnosis. IVF is the most commonly used art. It has been proven useful in overcoming infertility conditions such as blocked damaged tubes, endometriosis, repeated IUI failure, unexplained infertility, poor ovarian reserve, poor or even nil sperm count. Intracytoplasmic sperm injection (ICSI) technique is used in case of poor specimen quality, low sperm count, or failed fertilization attempts during prior IVF cycles. This technique involves an injection of a single healthy sperm directly injected into the mature egg. The fertilized embryo is then transferred to the womb. Nowadays, there are several treatments still in experimentation related to stem cell therapy. It's a new opportunity not only for partners with the lack of gametes, but also for homosexuals, LGBT, and single people who want to have offspring. Theoretically, with this therapy, we can get artificial gametes in vitro. There are different studies for both women and men. Spermatogonial stem cells transplant. It takes place in the seminiferous tubule. With this treatment, the patient experiences spermatogenesis, and therefore it has a chance to have offspring if he wants to. It is especially oriented for cancer patients whose sperm is destroyed to the gonadotoxic treatment they are submitted to. Ovarian stem cells. It is thought that women have a finite number of follicles from the very beginning. Nevertheless, scientists have found these stem cells which may generate new oocytes in postnatal conditions. Apparently, there are 0.014% of them. This could be an explanation of why they were not discovered until now. There is still some controversy about their existence. But if the discoveries are true, this could be a new treatment for infertility. Stem cell therapy is relatively new, and everything is still under investigation. Additionally, it could be the future for the treatment of multiple diseases, including infertility. It will take time before these studies can be available for clinics and patients. Prevalence of infertility varies depending on the definition, that is, on the time span involved in the future failure to conceive. Infertility rates have increased by 4% since the 1980s, mostly from problems with the fecundity due to an increase in age. Fertility problems affect 1 in 7 couples in the UK. Most couples, about 84%, who have regular sexual intercourse, that is every 2 or 3 days, and who do not use contraception can get pregnant within a year. About 92 out of 100 couples who are trying to get pregnant do so within within 2 years. Women become less fertile as they get older. For women, age 35, about 94% who have regular unprotected sexual intercourse get pregnant after 3 years of trial. For women aged 38, however, only about 77%. The effect of age upon men's fertility is less clear. In people going forward for IVF in the UK, roughly half of fertility problems with the diagnosed cause are due to problems with the man, and about half due to the problems with the woman. However, about 1 in 5 cases of infertility has no clear diagnosed cause. In Britain, male factor infertility accounts for 23% of infertile couples, while 25% remain unexplained. 50% of female causes, with 25% being due to anovulation and 25% tubular problems and others. In Sweden, approximately 10% of couples wanting children are infertile. In approximately 1/3 of these cases, the man is a factor. In 1/3, the woman is a factor, and in the remaining third, the infertility is a product of factors on both parts. There are several ethical issues associated with infertility and its treatment. High-cost treatments are out of financial reach for some couples. Debate over whether health insurance companies should be required to cover infertility treatment. Allocation of medical resources that could be used elsewhere. The legal status of embryos fertilized in vitro and not transferred in vivo. Pro-life opposition to the destruction of embryos not transferred in vivo. IVF and other fertility treatments have resulted in an increase in multiple births, provoking ethical analysis because of the link between multiple pregnancies, premature birth, and a host of health problems. The religious leaders' opinions on fertility treatments. For example, the Roman Catholic Church views infertility as a calling to adopt or to use natural treatments, medication, surgery, or psychotherapy, and members must reject ART. The infertility caused by DNA defects on the Y chromosome is passed on from father to son. If natural selection is the primary error correction mechanism that prevents random mutations of the Y chromosome, then fertility treatments for men with abnormal sperm, in particular ICSI, only defer the underlying problem to the next male generation. The causes of infertility are wide ranging. Unfortunately, partners usually do not know there's a problem until they want to conceive, and then thrown into an endless spiral of diagnosis, treatment, trying to get pregnant and for failing, more diagnosis, more treatment, and more failure. Young girls jump rope, singing, first comes love, then comes marriage, then comes Mary with the baby carriage. Yeah, there is a belief that stars deliver babies. Okay. Maternal conditioning prepares girls to become mothers. Even girls who show no interest in babies or dogs while growing up still assume they possess the capacity. If not, they desire to have children. There is a Chinese saying, we never wander so far as when we think we know the way. Fertility issues affect at least 1 in 6 couples in the US. Today, fertility is complicated by the fact that women are waiting longer to become mothers. The average age at marriage for both women and men has been rising steadily since the 1950s. We are not marrying until we are in our late 20s or 30s. And we are postponing having our children until even later. We believe that we can have children anytime between menarche and menopause, and ask ourselves why not wait until everything is just right. The failures of Western reproductive medicine have galvanized women to seek out healthier, more holistic methods of fertility enhancement. The first records of fertility treatments using traditional Chinese medicine date back to well before the Christian era. Simple 4-step programs that can help you balance your energies and prepare your body to nurture a child. Each program is a Chinese treatment. And each program is designed specifically for the individual patient. The first step is to diagnose what's going on with your system, and how your reproductive energies need to be harmonized. The second step is to change your diet. The Chinese medical system, certain foods have specific properties generating heat or dampness. For example, depending on your Chinese medical diagnosis, you may need to choose foods that will help purify your blood or increase energy flow to your kidneys or eliminate stagnation in your liver. Add certain vitamin and mineral supplements to the diet too. The next step is to clear the energy meridians through acupuncture. There is no such thing as infertility. It is a myth. Infertility is just a medical condition that can be easily set right through naturopathy. It is also a lifestyle disease, since most of the times it is attributed to mental stress, smoking, drinking, substance abuse, and unhealthy sex with multiple partners, heterosexuals, especially CSWs, LGBT habits, which results in STDs. Men should avoid using laptop computers as a laptop device, since it leads to increase in pelvic region temperature, which has an adverse effect on the reproductive organ and quality of sperm. Alcoholics turn impotent or infertile. Eat nutritious food, exercise regularly, take adequate rest, relax, practice yoga and meditation. Stem cell therapy is a viable option to conceive naturally if you can afford it. Surrogacy is not advisable. There is no necessity to waste your money on so-called assisted reproduction centers, ARC. In case a lady is not able to conceive, best option is legal adoption of an orphan from a good orphanage. There are so many orphans who are leading a miserable life, get abused in so many ways, and ultimately their lives are ruined. Why can't you be a game changer and light up the life of an orphan? So many kids lose their parents in accidents, natural calamities, while some are abandoned by the mother for various reasons. I do not like to go into the reasons. Take pride in adoption. It's a good service to the society. Now you understand why I said the infertility is a blessing in disguise, right? Debates, discussion on open-ended topics like this can go on forever. Anyhow, let me pull the plug here. We'll meet again real soon with another interesting topic. Some of the statements used express are solely mine based on limited knowledge gained over 6 decades of versatile experience. Always watch these videos with closed captions, subtitles for absolute 100% comprehension as per my sincere recommendation zillion times so far. I know I rushed through to complete the presentation in 20 minutes, which is a norm that I had set myself to retain the viewer's attention. But nowadays I take almost double the time or sometimes even triple that. Since I make honest attempts to cover the selected topic more elaborately, referring a wide variety of materials, in particular Wikipedia quite extensively, besides other books and articles published recently. Stayed. Besides, of course, I sprinkle my own salt and pepper and season it with my personal experiences so far in my life and also intuition. Stay at home as much as possible to maintain social distancing attributed to pandemic novel COVID-19 and prolong your lifespan. Lead a healthy life. God alone can put a stop to natural and unnatural events, such as biowar and cyber war, events like pandemics, which may lead to apocalypse and extinction of all sentient species on Earth for no fault of others. Rest in peace and harmony.